right, everybody. Hi. Thanks so much for your patience. We have just been waiting for our speaker to arrive, and he is parking now, so he'll be here soon. In the meantime, I wanted to welcome folks and introduce ourselves. So my name is Dinah Stevens, and I am the program manager for Age Friendly Seattle. And these events, these Civic Coffee events, are hosted by Age Friendly Seattle in partnership with the Seattle Public Library. So thank you, Emily, for being here also from the library. There's materials on the table. You can check out what's happening at the library. I also wanted to check in and ask all of you, how many of you have a gold card? Okay, I see one hand. So, good news, everybody can have one today. If you are age 65 or older, I really encourage you to grab a gold card from the back of the table here. It gives you discounts all around the city, at museums, at restaurants, at retailers. There's a whole list of organizations that provide discounts to older adults, and it's free to have a card, so, they're coming around now. And if you know other people who could benefit from this, feel free to grab one for them as well. So with that, I want to give a big thank you to the Filipino Community Village for hosting us here. It is a beautiful space. I've never been here, and it's really gorgeous. But I also want to acknowledge the tragedy that happened in Vancouver over the weekend. I think we can't start today's program with recognizing this event, what should have been a joyous celebration of Filipino culture and history, ended in violence. And I can't offer any rationale or reason for this or way to make sense of it, but I can acknowledge that there's probably a range of feelings that people are holding right now, whether you know someone who was at the event, whether you are mourning for the community at large, whether you have feelings of fear or anger, anxiety, sadness. I just want to honor that and hold some space for that. And today's topic just happens to be focused on mental health. This is a pre-planned topic, but it really feels very salient right now, as acts of violence like this and other things that cause us fear and anxiety and grief can certainly impact our mental health. And we know that far too many people experience mental health conditions that go untreated, and people go unsupported. So during today's program, we'll be providing some suggestions for how to spot mental health conditions and how to recognize them in the early stages and how to support people in your life who may be experiencing those. So with that, I am going to introduce our speaker once he arrives. I think he's still parking, looking around the room. But I'll start by sharing that he is with an organization called NAMI Seattle, and I'll let him explain a little more about what NAMI does. But primarily, NAMI helps to fill the gaps here locally in our mental health care system. It's a large grassroots organization really dedicated to supporting individuals who are experiencing mental health conditions for which they need support. We'll welcome Dr. Gutierrez-Sanin.
Thank you.
So Dr. Gutierrez-Sanin wears a lot of hats. He is a physician, an educator, a content creator, curriculum developer, instructor, thought leader, and public health professional. And today he's speaking on behalf of NAMI, and I just gave the group a very brief introduction to NAMI Seattle, but would love for you to take over in a moment and provide more context for that. He's got an extensive professional career in public health and mental health, developing resources for reducing health disparities, improving access to health services, especially for immigrants and refugees with limited English proficiency. And for multiple years, he's been recognized as a top mental health first aid instructor. He's worked frequently with federal and state agencies, as well as local organizations, and he currently serves as home care program manager at Highline College. He also serves as a subject matter expert for curriculum, for continuing education courses for home care aides and other healthcare professionals. So with that, I'm going to hand the floor over for Dr. Guderian to lead us in a conversation around mental health. Thank you.
Thank you very much. Really nice to meet you all. And thank you for that introduction. I wish I was like 5 inches taller now. I don't know. Did I do all that? Anyways, without any further ado, because I really was confused. I thought they told me 2 p.m. and I had a class ending at 1 p.m. at Highline College. So I'm like, oh my God, what happened? And so, anyways, I'm glad to be here. And you can see my contact information on the screen. If you can give me the next one, so that's me. I was born and raised in Colombia, South America. I always refer to myself as a recovering physician because I was a doctor for a long time. I did occupational medicine, and then I came to the States to do grad school and decided to go get a master's in public health, and the university hired me, and then I discovered the classroom, and then after that I never wanted to get out. So I am still recovering from that. It's a long road, but I'm more and more sure that I can at some point in my life behave like a normal person. And so I was a specialist in occupational health. I have a master's in public health, and happily married to Claudia, who is a wonderful person. And I play guitar since I was 7. So every conceivable style of guitar. As a method of self-care, I practice Qigong, or Qigong, which is Qigong, yes. It's an ancient Chinese martial art part of Chinese medicine, which I also researched extensively. And it's like a really great way of regulating your allostatic load and increasing your vagal tone. And I have another conference on that, so I'm not going to keep going on with that. And I also, as you can see by this somewhat awkward picture, love the outdoors. I love to go out in nature, see the trees, see the things, beautiful sights that we have here in Washington State. And so this is just a little introduction for what we're going to do in a minute about introducing ourselves to each other. So you can give me the next one. And so NAMI is the largest grassroots mental health organization in the US, which is dedicated to building better lives for people impacted by mental illness. And what is the difference between NAMI and other organizations dedicated to mental health is that it's entirely made out of volunteers, right? Including people with mental illness. And it has more than 600 local affiliates nationwide. NAMI Seattle was the first one. It was the first branch of NAMI nationally, and made strides to fill the gaps in our local mental health system through education, advocacy, support, and referral. I particularly came across NAMI because a very good friend of mine is a member of the board of directors. His name is Sean. Actually, I had dinner with him last night, and I was talking with him about this particular presentation. And so he told me to tell you that NAMI is very proud to be here, and that we hope to make a difference in your community and to continue to be in touch and continue to develop better and more interesting projects. So, if you want to go ahead and give me the next slide, please. And so, a few reminders before we start, right? Remember, we all speak from our own experiences, knowledge, and truth, right? Notice the balance of who's speaking and who's not, right? And maybe why not everybody is speaking. Not everything has closure in life, and some of the hardest experience that you might have had didn't really make sense or didn't really have closure, and that's okay. Confidentiality, right? So you can share what you learn, you can share what you heard, right? But when you leave the room, all the names, all the identities of people who are participating in this workshop are left here, meaning, you know, what happens in this room stays in this room, kind of like the little Vegas room. Imagine you're in a huge casino and, you know, you get up the next day, you have no idea what happened, right? And then, you know, make sure that what transpires from this meeting is has an impact, and that impact is an intent to do something different, to change something different, to go out and do something to change someone's life for the better, right? Does that make sense? So let's go ahead and go with the next one. So the World Health Organization says that mental health is a state of well-being that, you know, and it's a state of being that is mental and emotional, right? That allows a person to have, you know, a life that is fulfilling in a couple of different areas, that enables a person to work successfully, to interact successfully and be an accepted member of their community, and to have satisfying personal relationships with others, right? And admittedly, there's a couple of problems with that definition, because who here has, you know, and also can deal with the normal stresses of life, right? Without, you know, having a hard time, let's say. So who here is able to cope with whatever normal is right now without having difficult feelings? Who here can work productively and successfully every single day of your life? Who here makes contributions to their community on a regular basis? Who here can have satisfying personal relationships always? Right? And the answer is maybe one or two, right? But the majority of us don't really get to say that. Right? The majority of us have good days or bad days. And so one of the problems with the definition, right, is that it's something to aspire to. It is a definition that doesn't account for a magic word called resilience, right? Which is the ability to overcome obstacles and go on and strive to continue to better your mental health. So if I'm a person who needs to take a pill every day to be able to continue to function at a high level and, you know, do what I do and be successful, does that mean that I'm a person who has a mental illness or a crazy person? Of course not, right? But that's not in the definition. And so I actually have a friend who's working with the World Health Organization in New York, trying to rework the definition to make it into something a little more comprehensive that accounts for, you know, resilience and for the ability to overcome challenges, right? And for adaptive mechanisms that can lead a person who has had mental health challenges lead a happy and successful life, right? And so that's one aspect. Another aspect, and we're going to deal with that aspect, is stigma, right? You mentioned the word violence, right? Who here thinks that people with mental health conditions or mental health challenges are violent?
Not acceptable.
Very good, great job. Yeah, and so that's, a lot of people say, hey, you know, those violent, crazy people who go out and do crimes and they are not super violent. In reality, mental health conditions account for only 4% of violent crime in the United States. So 96% of violent crime is unrelated to mental illness. And that surprisingly includes mass shootings. So I have people in classes asking me, hey, so how do I keep myself safe from a mass shooter who is undoubtedly a crazy person? And my answer is, you know, you're really wrong about that. So when you research that, that population of mass shooters, it turns out only about 5% of them have a diagnosis of mental illness. The remaining 95% really are in a socio emotional complex situation that is not a diagnosable illness. And so those are really, 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 really important things to comprehend, to really understand what mental health is, right? And then we talk about mental illness, right? So to be mentally ill means to have a diagnosable condition that makes you unable to hold a job, right? Unable to function in most areas of your life, having something that causes significant distress and pain, that gets in your way of making contributions to your community and be an accepted member of your community, and develop satisfying personal relationships. So it is, again, a functional definition. Right? There's a lot of really interesting insights about mental health, and one of the most fascinating ones are led by neuroscientists like, for example, Judy Rappaport out of the University of Colorado, who's been studying the human connectome. It's kind of like the wiring diagram of the human brain. And so she's found out in children who will later, as adults, develop schizophrenia, she's found an abnormal, widespread development of abnormal connections in their brain. It's not like dementia, where you see, if you do a fMRI or a PET scan of a person with Alzheimer's, you're going to see that brain is like a Swiss cheese. It's losing parts of the brain. Right? It's more like a city where the streets go nowhere and where the traffic lights are in yellow constantly, and there's all kinds of crashes and things as a result. And so what they are saying is, if you would find a way to predict and to do an early intervention, right, before symptoms developed, then you probably would be able to start preventing the development of symptoms of schizophrenia. We're not there yet, but it's really hopeful, right? And so there's a lot about mental illness that we don't really understand. Just like you said, it is really difficult to read the mind and to understand how the mind develops into mental health conditions. But we can identify precursors and risk factors that can lead to mental illness in adulthood, right? And one of the ones that I'm going to refer to, I don't know how much time left, I'm so sorry, is trauma, particularly trauma when you're a child. Yes, so if you can go ahead and give me a next slide, let's take a look at prevalence. Right, so how common are diagnosed mental health conditions in adults in the US? What do you think? There's a bunch of numbers here. What do you think? How many people do have a significant mental illness every year? Or what is the percentage of people? You're right. In fact, 23.1%. So if you can give me a next one. 23.1% is the general prevalence, which is staggering, right? That's almost 1 out of every 4 people in this country. It's almost at 25%. Can you imagine a serious condition having a 25% prevalence? Imagine a country where 1 out of every 4 people had cardiovascular disease or diabetes, right? So what would be the outlook for the future of that country? Well, so mental health conditions are really, really prevalent, but the most concerning thing is that almost 1 in 3 here, or more than 1 in 3, right, at this age range, 18 to 25 years of age, had a serious mental health issues during 2022. So almost, 30%. And that is even more concerning. That means these diseases are something that has a very early onset, right? 75% of mental illness develop symptoms before age 24, 50% before age 14. And because of that, when you look at the distribution of mental health across age groups, you'll find that they have the highest burden of disease across the world, meaning that they are the main cause of disability worldwide. Chiefly anxiety and depression, which are the main.
Doctor, is screen deficiency syndrome part of that mental illness?
Is what?
Screen dependency.
Screen dependency. I don't think that is a diagnosable illness per se. I mean, it's not in the DSM-5, right? So are you?
Because I'm looking at the age of people that could be affected with AI.
Right.
But as we see our children today, they are exposed to gadgets.
And I can see it being a risk factor. I can see how certainly social media can be a significant risk factor for younger people. But I wouldn't leave it at that. I'm going to say there are many complex social dynamics in the modern world leading to the development of these problems in our younger people. If you want to read more on problems with social media and things like empathy and ability to relate to others, Daniel Goleman has a really great article in I think it's the Harvard Business Review, where he writes about these things, but really, really fascinating about how, by being connected online and, feeling safe online, unloading what we feel about other person without having regard for how they feel, is making younger people less able to actually connect and look at someone else face to face, and then develop a deep empathy for that person. And that's a huge problem. But I want to say, and just to wrap up by answering in a nutshell, it's a lot more complex than social media alone or than screens alone. There's a lot more factors. And so, by race, right, you can see that people who identify as multiple races, according to SAMHSA, have a higher prevalence of mental health, and that might be an instrument, right? That might be an instrument. I'm thinking there's a lot of people who identify as biracial, and they may be a combination of Hispanic and white, or Asian or Pacific Islanders, who say, "Hey, I have more than one race," and so they contribute to this column being bigger. So I'm not sure of that being completely accurate.
We have about 15 minutes, so if you want to pace through.
So let's keep going. So what causes mental illness? So there's a number of different cases, right? So genetics, right? So some causes that have genetic markers, and one big example is, for example, schizophrenia. Another one is bipolar disorder. Environment, and so environment and trauma kind of go together, and this is explained partially by epigenetics. But have you ever heard of the ACEs or the ACE study? So there's a huge study done around the country where they try to measure the impact of trauma on mental health, and they figure out that people who have been exposed to a lot of trauma in their early life are much likely to develop all kinds of mental health conditions and also substance use disorders. And so, we know that is a very clear risk factor. And then biochemistry also, right? So about half of people with serious mental health conditions also have a substance use disorder on top, and that is mostly from self-medicating. And so that is also a really important aspect, right? So what are the most common mental health conditions? Just keep going. So anxiety and depression by far, right? Those are the, like I was saying, leading cause of disability worldwide. And then keep going. So, serious mental illness is defined as a mental, behavioral, or emotional disorder resulting in serious functional impairment, which substantially interferes with, and I have given you a definition already, and examples of those include bipolar disorder, schizophrenia, schizoaffective disorder, PTSD. Complex PTSD is really not in the DSM-5. It is acknowledged in the ICD-11, which is the other classification of diseases. But yes, multiple instances of trauma leading to mental health disorder with symptoms like panic attacks. It's also common, right? And so the past year prevalence of serious mental illness among U.S. adults, right? Across age groups. So again, you can see, and then by gender. And so here you can see I guess a much higher prevalence on, again, the age group 18 to 25, right? Females, and that also might have to be with the tendency of women to be a little more conscious of their mental state and to be more free and willing to share their emotions, so they are more diagnosed, right? And the testament of that is suicide. So when you kind of talk to people about suicide, which is really not a mental health diagnosis, but it's a condition, usually the result of a diagnosis, is that women have more suicidal ideation than men, almost twice, but men actually die by suicide a lot more than women, almost 4 times more. And so you can see that how we kind of hold back, but then the consequences tend to be more serious. So what percentage of adults with mental health conditions receive treatment? How many people who are diagnosed with a mental health condition actually get treated? Okay, so you are not wrong. It's not low, but in fact, actually, it's a little higher than that. So about 50%. And you can see the distribution of treatment by sex, by age, by race here, and so that also reflects disparities in access to treatment, right? But just about half, which is more than other parts of the world. In Colombia, my country of birth, for example, only 40% with mental health illness ever gets treated, which is kind of dismal. And so, okay, keep going. And so one of the main reasons why people don't get treatment is stigma.
Yeah.
And so, what does stigma do? What is stigma, right? So stigma is what happens when someone starts judging you or thinking that you are different or inferior, and you start getting, the doors like slam on your face and not being able to get support or love from your community, and so you start hiding what's happening with you, right? And that sadly happens a lot, particularly to young people here in the United States. And so family and friends criticizing, and I once knew a person with a serious mental health condition whose mother told her, I just can't love you because you're just not normal. And so you can imagine the damage something like that can do to someone's self-esteem, right? Cultural norms, right? Of course, lack of access, right? We here proudly, as a country, have the most expensive healthcare system in the world, where 60% of bankruptcies filed in the United States are because of medical bills. I don't know if you have experienced those problems. I personally have not known anyone who hasn't. And then criminalization, right? So good intentions, but really a bad way of going about, because it's pushing people further in the shadows, particularly people who have a substance use disorder. Right? So I'm going to lock you up in jail because you are sick. Right? That doesn't really make a lot of sense. Good. And so, right, what happened as a result of stigma, right? So people may be just afraid of seeking treatment. They can be misdiagnosed because they don't speak clearly, and psychiatry and psychology are one of the two health professions in which the medical interview, right, asking questions and getting straight answers from a patient, actually are critical for making a diagnosis. There's not a test that I can run and tell me, hey, you have bipolar 1, right? Or you have post-traumatic stress disorder. Can't do that. I depend on what you tell me, right? So if you hold back and you don't tell me, I can come to the wrong diagnosis. That happens quite often. Lack of responsive treatment or lack of adherence too. Right? So I start treatment and then people start judging me and telling me, those pills don't really, those pills aren't really helping you. Those pills are changing your way of being, and you should stop taking them. And so I quit. Right? Shame, stigma, right? And then of course I have an increased risk for suicide when people don't feel supported by those who should have been their support group. Okay, keep going. Right, so in here we have some examples of person-centered language versus person-not-centered language. Right? So I talk about mental health condition instead of brain disorder, brain disease. We say the weather is unpredictable instead of saying the weather is bipolar. We say my daughter has schizophrenia instead of my daughter is schizophrenic. We talk about a person with a mental health condition or a person with a mental health challenge instead of a consumer client or patient. We talk about someone who lives or has or experiences instead of someone who suffers from, is afflicted with, or is mentally ill. We talk about someone who dies or attempts suicide rather than someone who commits suicide. Why do we avoid that word commit? Because what do people commit? Crimes, right? Or sins or mistakes, but generally not good things. And so it's judgmental, it's a stigmatizing language. And so when we use language that is centered in the person, it's really a lot easier to connect. Keep going, please. And so, I don't know if you have ever been to a terrible situation and people have just told you to focus on the positives or to get over it. And so here's some drawings that can illustrate that. So here's, the first person is saying, I get that you have food poisoning and all, but have you at least have to make an effort. What do you mean you have food poisoning? Or you just need to change your frame of mind and you'll feel better. This one is bleeding here. Or have you tried, not having the flu? Or I don't think it's healthy that you have to take medication every day to feel normal. Don't you worry that it's changing you from who you really are? Have you ever heard those in any context of your life? Any of those? Yeah, I've heard at least a couple of them. And so, that really discourages a person from their perspective of recovery. Okay? Give me the next one, please. And so, common symptoms in adults or teens. I can't really see this line here. That says withdrawing from normally enjoyable activity.
Isolation.
Right? Which is, well, aside from isolation, is this universal symptom called anhedonia, which is losing the ability to enjoy the things you used to love. Right? I told you I'm a guitar player, okay? So the guitar is kind of part of my body because I've been holding one since I was 7. If at any point in my life my guitar is sitting there piling up dust, not being touched by anyone, that means that something's wrong with me. I'm losing my ability to enjoy something that's part of me and that I've loved all my life. Excessive worry or fear, extreme lows or highs, feelings or moods. Physical problems without obvious causes. For example, back pains or neck pains or stomach pains are standard symptoms of depression or anxiety disorders. Strong feelings of anger, irritability, or guilt. Constant negative self-image. Oh, I'm just so terrible. No one loves me. I don't deserve to be liked by anyone. I'm just, I'm a worm. Right? Type of self-talk. Changes in your eating or sleeping habits. And so, that's a sign of distress too. Like, that's another talk. So, difficulty concentrating. And issues arising from, of course, substance use disorder. Again, according to SAMHSA, about half of people with serious mental health illness also have substance use issues. On top of that, when someone who usually gets good grades starts getting bad grades, right? Excessive worry or anxiety, having nightmares, physical problems without obvious. Hyperactive behavior, unexplained weight gain or loss, difficulty concentrating, temper tantrums. So emotional dysregulation is a really, really common sign of severe stress when it's chronic, and you see that. And of course, as you know by the definition of mental health conditions or mental health illness, it causes severe distress. And so one landmark sign is blowing up, right? Out of seemingly nothing. And then severe changes in mood that are going to interfere with your performance at your job, in your home, in your school, etc. Okay, so what are some common treatments? Of course, psychotherapy. It can be individual or group therapy. Medication when it's indicated. EMDR. Electroconvulsive therapy for extreme cases and other modalities. And then also self-help and lifestyle changes. For me, it was Qigong. It really changed my life. And so I had a very serious loss a few years back, and I was so depressed that at one point I wasn't able to stand from a chair without help. And my best friend, who happens to be a Qigong master, came to visit me, and he invited me to his studio, and he said, hey, you can practice with me for free. And so I started practicing, and I've been practicing for 3 years, and now I've been back to being myself. And, changed my perspective in so many things that I really started reading about it. And I am not saying that you all start practicing Qigong tomorrow, but I'm saying look for ways, or look for practices, or look for things that you can do to help you feel better about yourself and the people around you, right? So for some people that is physical exercise, which has also, mindful exercise has been shown to be amazing by research in decreasing chronic stress and increasing the volume of the hippocampus, which is the area of the brain that learns and comprehends things, and also preventing symptoms of dementia. Yoga does the same thing. Tai Chi does the same thing. Water aerobics does the same thing. For some people, positive cognitive reframing can do the same thing. We all have our own, right? So what I'm telling you is look for yours. Right? What is the practice that you can do to help to can make that can make a difference in your life? Glitch. All right. So So how can you talk to someone that you're concerned about that might have a mental health challenge, right? So listen, just provide a sounding board, listen without judging. Tell me what is happening to you and just provide a listening ear without passing judgment on the person and without providing advice, without arguing, right? Focus on the feelings of the person, not necessarily on the facts, right? And ask them if they have someone to talk to, right? If they have quickly changing emotions, just take a deep breath and go with the flow. If they have changing plans, just stick with your commitments. If they have little empathy for you, recognize that this is a symptom and it's not personal. If they believe in delusions, acknowledge, but don't play into or argue. So I have a funny story about this. When I was a medical student, I was doing a rotation in psychiatry. And there was this friend of mine, this classmate, who was talking to a woman with schizophrenia. And so he was trying to empathize with her. And when she told him about the voices in her head, he's like, yeah, I can hear the voices. And so the next day she had an appointment with the psychiatrist and she was arguing with the psychiatrist. The doctor told me he could hear the voices. And so don't confirm the hallucination, don't deny the hallucination. Instead, focus on the feelings. It must be terrifying to hear those things. Why don't you tell me how that makes you feel? Right? That kind of talk, instead of either the voices are real or they're not. If they have a low self-esteem, stay positive. Tell them something like, you're not alone, you matter to me, you're important to me. Or highlight something that they're really good at. If they're preoccupied, get their attention and redirect their mind. If they are withdrawn, then you can initiate a relevant discussion, right? In an empathetic way. So here are some conversation starters, right? I've noticed, and you can see these are all I statements that I'm using to relate my observations. I've noticed that you're sleeping more, eating less, right? I'm here if you need to talk. Or tell me more about what's happening. Maybe if I understand better, we can find a solution together. Or I'm concerned to hear you talking like this. Let's talk to someone about it. Now you can give me a next. Thank you. Would you like me to go with you to a support group or a meeting? I really want to help. What can I do to help you right now? Let's sit down together and look for places to get help. I can go with you. Right? Remember, you're not alone. As simple as that. Be an ally, right? Learn more about mental health conditions. Avoid saying things like, you'll get over it, or just toughen up, or you're fine. Just gotta get over yourself. Tell your friend it gets better, right? Help and support are out there. So you don't have to suffer alone. You don't have to carry this burden alone. Right? There are places you can go. There are people who are qualified to treat and to help you with these symptoms. Okay? Next. So, what are some things that you have found helpful for folks experiencing mental health symptoms? Have you ever talked to someone who might be experiencing a mental health symptoms? What have you done? What has worked for you?
General thing that I found to be helpful is just time, space, and understanding.
Yeah.
So giving them time to talk, giving them space if that's necessary, right? And then understanding what you're talking about. It's helped me at least.
Yeah. There's various ways. Sometimes the best thing that you can say is nothing. Just be there.
Just listen.
Listen, exactly. And so if they kind of know and feel better, that is already helping. That is already reducing the risk. Okay, Great. Anyone else? Yeah.
Checking in. So
Checking in, yeah.
don't let it be just one conversation. Maybe after a day or two, just, hey, how's this going? The last time we spoke, how are you feeling now?
Yes, continue to support, continue to be present in the person's life, right? Don't be discouraged, just continue to follow up in a non-invasive, respectful way. Just be a presence, just be there. Right? That also will enable you to figure out if there are crises, and if you have to call something else like 988, the National Suicide Prevention Lifeline, or 911 if you need an ambulance, right? So if you're not there, you'll never see, but if you are there, then you can react. Okay, great job. Last one. So, crisis connections, right, for King County. So that number is 1-866-427-4747. 211 to find resources for housing, food, right, etc. 988.
Suicide.
And that is nationwide. It was called the National Suicide Prevention Lifeline. Now it's the National Suicide and Crisis Lifeline. And so you can call that number in any kind, if you have a person in any kind of mental health crisis, whether it's suicide or a panic attack or whatever. You can get connected to a crisis counselor and put it on the phone or seek advice from the counselor. And then our NAMI Seattle helpline, which is 425-298-5350. Also helpline at namiseattle.org. All right. And then, of course, NAMI programs that you might want to be aware of. If we have a helpline, we have other presentations called In Our Own Voice, Ending the Silence, classes that can be either peer-to-peer, family to friends, family to family, or workshops like this, support groups that are also peer family support groups, and all of those NAMI programs are free and open to the public. And you all have the contact information in case you need to get in touch with them. And I think that is it for today, unless there's something else. So I just, I don't know if we have any time for questions or answers. Okay, so that's it. I thank you very much for your attention. I really appreciate your patience with me today. And I really hope to see you again in the future.
Thank you.
Thank you so much. I'll give you the microphone back.
Thank you so much. I don't have anything else to add other than, again, thank you, Dr. Gutierrez, and thank you to the Philadelphia Community Village for hosting us. My big takeaway from your presentation, in addition to some of the tips of how to talk about mental health, is really find something you love and hang on to that. And so thank you for that. And I will just invite folks to grab any food that's left and stick around and have a conversation. And we will be hosting the May event at Southeast Seattle Community Center. Change that date. All right. Thanks, everybody.
Thank you.